Hello, my name is Dr. Robert Barnes, and on behalf of the physicians, physician assistants, nurses, and staff here at Digestive Health Associates, we wanted to send a message and review what we've entitled Resuming Endoscopy on the Downside of the Curve. You all know that for a number of weeks now, elective procedures like endoscopies have been put on hold while the COVID-19 pandemic has been addressed, with all of our resources being put on hold in order to address the spread of this virus. Now that we have come to the other side of the pandemic curve and things are beginning to settle, it is time to then readdress all those needs that have been put off for 6 to 8 weeks or more. So we've had a lot of questions from patients about scheduling endoscopy procedures, and so we just wanted to take this opportunity to review with you some of the precautions that we've put into place in order to assure the safety of all of our patients and our staff. So just to review, the Copper Ridge Surgery Center, CRSC, has begun some new safety measures, and I'll go through these point by point. First of all, we've done pre-screening patients. In other words, your patients will be called about 2 days ahead of their scheduled procedure, and screening questions like presence or absence of fever, presence or absence of cough, those types of questions that might identify patients at risk for COVID will be asked. Now, eventually, the screening process will be improved once we have more availability with COVID testing. So it will become a little more sophisticated as further testing becomes available. But for now, this is the standard. Secondly, we'll be doing COVID screening on everyone who enters the building downstairs in the surgery center. That includes patients, anyone who accompanies a patient, all of our staff, including physicians, nurses, everyone who enters the building will be screened at the time they enter the building as well. Next, in addition to the normal comprehensive cleaning and disinfection that goes on in the surgery center, we've done even a higher level with disinfectants recommended by the CDC, and that is going on a daily basis throughout the entire building, even in non-clinical areas. So a very important step. Number 4, we are observing universal masking for everyone in the building. And also we have made provisions for proper social distancing in the common areas. So for example, everyone who comes into the building can either wear their own mask, or if they don't have a mask, one will be provided for them. All of the endoscopy personnel will be, of course, in PPE, and I'll get to that momentarily. Number 5, there's a restriction on all non-essential persons from entering the building, so that presently the patient will be entering the building, going through their diagnostic and therapeutic testing, and whoever's accompanying them will be asked to wait in the car outside the building with the pager. Once all the procedure is completed, the patient will then be brought out to the car, so this minimizes the number of people that are in the building at any given time. Next, all personnel who are treating patients will be covered with complete personal protective equipment. We call that PPE, and that is to prevent any kind of infection from going one way or the other. So an added level of safety there. And then finally, every room is disinfected after each endoscopy case. This takes a little extra time, but during this time we feel that it's worth it. And so that after every colonoscopy, after every EGD, the room is completely shut down, completely disinfected, and prepared for the next patient. Now, we feel that these do give us adequate safety that we can assure to our patients. And we do feel that now is a good time for us to resume the care that's been delayed for so long. So when you look at the risk of acquiring COVID versus the risk of delays in diagnosis or treatment, we now feel that the balance has shifted such that we need to get on with the business of providing top quality digestive health care. And we hope that this message will help to reassure you that we're taking all of the proper precautions. So we're looking forward to seeing you, getting you back, getting your tests scheduled, and getting you back to good health. Thank you.